All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have Dr. Sarah Kareem. Welcome to the podcast.
Thank you so much, and thank you for having me.
Yes, I'm excited to talk all about you and your practice and what you specialize in today. So, why don't you tell us a little bit about who you are and what you do?
Okay, well, I'm Dr. Kareem. I'm a board certified family medicine physician as well as obesity medicine. And I've been in practice since 2018. I opened up a practice called ZenLife MD, and I have been working prior to that as a hospital doctor. So I have more than like 10 to 12 years of experience as a physician. And I'm very excited to talk about the upcoming things about regenerative medicine and primary care and how we can put all this together along with aesthetics. So, yeah.
Yeah. So you have a very, diverse journey and interesting background in family and hospital medicine and growing up in the Middle East and everything, and then practicing in the US. So kind of how did that get you inspired to start Zen Life MD and also get involved in aesthetics and wellness?
So, growing up overseas and seeing how medicine is practiced there versus over here, it just gave me a lot of insight because overseas, you don't just give a medication for every symptom. There's always a talk about what's going on. And when I came to practice here in residency, every time it's like, okay, well, the patient has this, just give this medication and that medication. So that's kind of the norm over here. And I feel like I needed a space where patients can feel like it's the inside and out, like have a whole body approach, which I grew up with overseas. And I think that's important to also recognize that it's not just the internal process we're dealing with, we're also dealing with the outside. So that's the reason
Mhm.
I opened Zen Life MD, just as a space for patients to have a way to communicate with their doctors about deep-rooted problems. So
Yeah, I love that. And it's totally true that in the United States, our medical education has been traditionally, focusing on, slapping the Band-Aid, treating the chronic condition instead of preventing things. I do think there's a big movement, hopefully, right?
yeah.
It's training the new doctors to maybe also learn to prevent things. So we're
Yeah.
hoping. But yeah, so I guess I was going to ask you what exactly Zen life it kind of means to you
Right.
personally and professionally.
So Zen life, it's just more, it's not a name, it's more of a mindset. Okay. So it basically reflects my belief that healthcare should be evidence-based and it should be personal as well. So the name, as it says, Zen is like more about inner harmony, mindfulness, and life, vitality, longevity with an MD. So that's kind of where the name came about. It's the process of like being proactive with regenerative care. And my goal in this is not to slow aging. It's more about letting patients live like a purposeful life with energy and balance, because I feel like that's the issue. A lot of people are on these medications all the time. They're not feeling good. So it's about putting everything together and not just focusing on one thing. So that's the reason I created Zen Life MD, and that's what it means.
Yeah, you're right. I mean, with focusing on one thing, you're kind of like siloing their entire processes, like how we silo things in medicine, right? So thinking of the whole body, the whole wellness approach, inside and out, I think is, a great concept. And I love the name. That's wonderful. So you've been talking already a lot about inside, outside. So you say often that, beauty, anti-aging, and wellness shouldn't be separate. So how do you get them to be synergistic in your practice, and why do you think that should be?
Well, okay, let me give you an example of my approach when a patient comes in. Okay, so suppose a patient comes in for a face procedure, okay, like the aesthetic part. I do a consultation. I don't focus just on the face. So I kind of go deep down into what their primary problems are. What are their, because being a primary care physician as well, that helps me get down to the deeper side of the problem. So I kind of go into their sleep cycles, their lifestyle, because all of this is affecting your skin. And we'll go in that, I'll tell you about that in a minute, but I think having stress, the nutrition, I go into the weight gains, any signs of depression, their health, mental health, all of that coincides with how you are on the outside too. So
Mhm.
that's how I navigate it. I kind of take all things together and then make a plan for them and we go through that journey together. So That's what we
Yeah. I mean, you've obviously been, kind of already in this a little bit earlier. I think the longevity aspect, which we will talk about, but 2018, I feel like it's more of a newer concept a little bit, and you've kind of been in it for a while. So I definitely think that we're going to hear a lot of expertise from you today. But I guess back to the beauty part of it, but the skin health or outward appearance, how does that influence someone's mental health and self-esteem?
You know, I think it's very overlooked at how much the outside is very intertwined with the inside. Okay, so for example, if somebody is not feeling good on the outside, they don't feel as, as good as they used to be 10 years ago, they're not going to feel as motivated on the inside as well. So there's one aspect is the medical aspect. They're not trying to, do better on the inside to preserve themselves. And
Mhm.
also, you know, they're not dealing with the stress properly. And sorry, just one.
Yeah, no, I totally agree. I
Yeah.
mean, I just think sometimes about acne, not to be boring, but acne is just a great example, right? So when you're stressed and you're not sleeping and, hormones are going crazy, sometimes we see that it
Yeah.
reflect on the outside, right? So
It's
things that
not
are
just
going
that, but
on.
it's also the depression aspect. That's what I was
Yeah.
trying to get to. So you're talking about the outside and the inside, the
Mhm.
skin conditions and how you look on the outside not just affects your inner the medical issues, but it also can affect your mental state. People get into depression, they get into anxiety, they get into low self-esteem, and all of that is connected, So that's what I'm trying to do here is like a whole body approach, not just the skin separate or the inside of the body and the general longevity separate. It's all going to be connected
Mhm.
together.
Yeah. I want to bring up an example. I think of what you're saying. So, like you're saying, if there's a skin condition on the outside that could cause, anxiety, depression, or anything like that, or self-esteem issues. So, I will say I suffered from melasma pretty bad, especially like younger and pregnant and things like that. And honestly, I felt so sad. Like it is depressing. It definitely you lose your confidence, and I think that's just a baby example of what could be going on, right? So it's very important. You're right. Like you have to think about the whole body approach, like you're saying. So it's important.
Right.
Yeah. Are there any misconceptions people have about aesthetics or anything that you'd like to dispel?
That aesthetics is just vanity.
Mhm.
I feel
Yeah.
like a lot of people think, oh, oh, you're going to get skin stuff done, you're getting Botox done or whatever. They think you're just being vain and that's
Mhm.
it. But no, I would say it is so interconnected that people need to start looking at both. Because the more you try to just think it's vanity, you're not going to take care of the inside. And that's going to affect the whole overall approach of longevity. Yeah.
Can you think of any like good cases or examples of patients who improved their kind of overall well-being after focusing on their aesthetics or anti-aging treatment?
So So I had a patient come in. She was a bit on the obese side. She
Hmm.
came in for she said she lost her husband and she wanted to get Botox done. She was trying to get out of that, cycle of depression and stuff. She comes in and then she tells me about how she just, we sat in that chair and she's telling me about how she feels, how she's like depressed and how she's really gained a lot of weight, all of
Hmm.
that. So while doing the aesthetic stuff, so I said, let's kind of make a plan. So we talked about her medications. We figured out there are a couple of medications that are not good for your weight. We started
Yeah.
her on obesity medicine, like a protocol. And I told her, I said, hey, you're gonna lose weight, but you also have to take care of your skin because as you lose weight, if you lose weight too quick, you can lose a lot of collagen. So that's gonna cause that Ozempic face that people talk about, which is literally just a lot of excess weight loss of collagen. So we talked about how to get the skin in control at the same time. So we worked on this for almost a year after that. And she really did well. She was in the best shape. Her skin looked great. We did a lot of regenerative treatments like PRP, exosomes, and microneedling and all of these things, along with the weight loss. And after 6 to 8 months, she was doing much better. And she said that it helped her mentally when she started
Mhm.
looking better, feeling better. So I think there's a lot of cases like that which can be helped. A lot of people can go through that and feel like there's nobody that can help them. And I feel like it's important to go through the hormonal stuff, the weight, the nutrition, the sleep, along with the aesthetics, and it can make such a big difference.
Yeah, absolutely. I'm going to put you on the spot. So, being an obesity medicine, have you had any cases or patients who maybe were living in a larger body and then lost a lot of weight and then kind of like couldn't refine themselves? Like kind of the opposite that some people think that they're gonna have. Everybody thinks everything's gonna be perfect after you lose weight, but
Yeah.
can you think of any like times where maybe that is like the opposite?
So no, some people have always had a high, body status for a while, and then when they lose weight, first of all, they can't get all that attention they're gonna get afterwards.
Mhm.
That kind of gets overwhelming for them.
Mhm.
Okay. And then they have this faith, they feel like they're not good enough, because they're still thinking in that mindset that they had. So it's about changing that mindset, but it's
Mhm.
hard, because it's mentally they look great, physically, but they're not mentally there yet.
Mhm.
So that I've seen a lot, and that's why I think it's important. So while you're there trying to lose weight or while they're going through that process, to do the mental health evaluation each time, so you can start changing that mindset from the beginning, and not like when they're suddenly lost weight and then they'll become more depressed. So
Mhm.
there is a phenomena like that. I feel like I've seen that a few times as well. So
Yeah, yeah,
yeah,
we definitely see that. And I think it is absolutely important. And which is why I love like that patients have the ability to work directly with, a provider rather than kind of like an online thing where they just get the medicine.
yeah.
Because there's like a whole mentality aspect of it that you really need to be okay with how you are, currently and accept that before you can move on and go through the process of big adjustment. And I'm usually talking about people who are losing a more significant amount of weight,
Right.
obviously, which is very possible, right, with all these new medications. So that's exciting that they're getting healthier, but as you're mentioning, their mental health needs to get healthier at the same time, right?
Right. So the one thing I do in my clinic is if suppose somebody, again, a lot of places have these online places which dispense medication, but there's no personal touch, and there's a lot to monitor with these medications as well. So
Mhm.
every time I have a patient, I call them in every 4 weeks and we do the scale. We have a talk and I kind of assess how their mental status is. And we kind of go through a lot of things like, how their nutrition is, sleep, and all that. So I can judge on where they're at. So I think that has helped a lot of patients rather than just give them medications, lose all this weight, and then figure out what to do with their mental health later. So it goes hand
Mhm.
in hand.
Absolutely, yeah. So what I don't do in my practice is something that you do. So like how do you choose, with patients helping with their internal wellness interventions and the external aesthetic ones, or how do you kind of combine them effectively?
Having a good treatment plan, having a good follow-up, having a good connection with the patient. Because I feel like if you just give them a plan and don't follow up, people are not going to get motivated to do it. So if I get personally invested in their journey, people know that there's somebody back there rooting for them.
Mhm.
And that is a really, really big part of my practice where it's a more personal touch. So I do the aesthetics like I make a treatment plan. So I have like maybe like a microneedling session or Botox. Then I'll have like the weight thing, and then I'll have hormones and then nutrition. We kind of do it all in that range of 1 year. We address everything. So it's making sure you follow up and talking to them about the nutrition and stuff, even while you're doing the aesthetics. So I kind
Mhm.
of combine these two. So
So what does the microneedling and the PRP and all the exosomes, what do they do and how does that make someone feel like they're, I guess, better on the outside?
okay, so my whole thing is to make the body work for you. Okay. And
Mhm.
the whole concept is to boost your own, like the body is to work for you, not against you. Okay. So
Mhm.
platelet-rich plasma, exosomes, these are procedures which help with stimulation of your own body's collagen. And this is kind of where the regenerative medicine realm is going. So, for example, microneedling helps with collagen stimulation and face rejuvenation. But the skincare that you do also helps. So we're trying to kind of stimulate your body. That's kind of what the whole thing is. It's not just about covering with like Botox or fillers or just covering things up. It's more about rebuilding, allowing your body to, get rejuvenated. So yeah, that's kind of what it is about.
Yeah. So I guess all of those things are also mostly helping with like collagen and,
Yeah.
giving it. Okay. Neat. Okay. So how do hormones like balance and nutrition and skin health all tie together to slow that aging process that nobody wants?
Okay, so let me give you an example of sleep. Okay,
Mhm.
sleep is, or it's very overlooked. Okay, so if you have less sleep, your cortisol levels are elevated, you have more inflammation, and this in turn, you know, inflammation and insulin resistance, all of this inflammatory things can cause your collagen to break down faster, your mitochondrial function to be not as good. So I think it all ties in together.
Mhm.
And I think combining nutrition is important too. So
Mhm. Yeah, so I feel you're saying like it helps balance. I guess when we talk about balancing hormones, that's a way to balance the hormones, right? You hear that a lot
yeah,
in the
yeah.
marketing literature of like, I want my hormones balanced. But it's so true, right? So focusing on the sleep, like getting those, improving those cortisol levels, like you're saying, sometimes people who are lacking sleep have elevated cortisol, which like, I think you were alluding to, like the increased inflammation and, also usually sometimes tied to insulin resistance when you are kind of getting enough sleep, it will lower that. And then it's less likely that you will have that inflammation. And then from your standpoint, because I don't know as much about it, you're saying that the collagen also would be doing better, right?
Yeah, there'll
Yeah.
be less breakdown of the collagen. That's the whole thing with the
Yeah.
aging process. Another example would be like excess weight, like obesity, right?
Hmm.
That leads to chronic inflammation, insulin resistance, and in turn breaking down the collagen faster and making you age faster on your skin as well as internally. When you have more wrinkles and all of that. On the other hand, you can have extreme weight loss. Extreme weight loss can also cause that. The
Yeah.
elasticity, the sagging, the loss of balance is going to happen. So that's why it's so important to have a physician-led care with this and not just, online or somebody who doesn't know how to deal with this. So
Hmm.
I think it's important to have it like inside and outside as well. So
Hmm. How would you approach a patient struggling with like weight, self-image, or confidence in a holistic way?
I would, uh, what I do is, again, getting them in that chair and talking to them, finding out the root cause, finding out what's exactly the why in this whole thing, finding out what the metabolic factors are, the hormones, the sleep patterns, the gut health. Getting all that information is important. Not a lot of people talk about it in an aesthetic visit, but I think talking about all that gives you an idea about what the patient needs and kind of formulate a plan for them. So
Hmm.
that's kind of how I approach it. Always, again, we talked about that having good follow-up and listening to them is important. So a lot of people don't feel heard.
Yeah, yeah. You're so right. Like I'm assuming I don't do aesthetics, but someone going to just an aesthetics appointment is not going to get that full person body care, right? They're really only focusing on, where do you want your Botox and
Yeah,
fillers, right?
yeah.
So I think that being able to really, like you said, focus in on the entire relationship and inside and out is definitely going to create a not only like better results, but longer lasting, which is
Mhm.
probably more what everybody wants, right?
It is, and I feel like a lot of places don't have that connection with the person. Like I feel like when they come in, I talk about their family. I know about it's like the primary care approach, the old primary
Mhm.
care approach, but I also deal with the more holistic thing. I hear this a lot from patients. They're like, "Oh, my doctor doesn't listen. They don't want to do some sort like they don't want adjunct treatments or anything like
Mhm.
holistic things with it. But I think it's okay if it's not harming you. I think it's okay to
Right.
combine things together. You don't have to dismiss the patient's thoughts about that. So working with them is important. So not just telling them what you think medically is supposed to be there, but also working with them is definitely important.
Yeah, I totally agree. I think that, if everybody, working together, I think whether the functional doctor or a holistic doctor or anything like that, everything can be included in the same, patient's plan or care. And I think that's important not to dismiss them. So, and not only that, I'm sure it will make them feel better and have, better mood as well. So you state, that healing starts from within, nourishing your body, calm your mind, and your skin will follow. What are some practical ways that people can live by that? Let's get some examples.
Sleeping better.
Mhm.
The sleep is so important. I think not scrolling on the phone at night in bed. That's so common now with like the phones and the internet. I mean, I'm guilty. I've done that
Yeah.
too, but I've had to force myself to, not do that. Other thing I would say is being consistent, forming habits. Like we can say all we want, but if people are not going to do it, it's not going to work.
Mhm.
So I think being consistent, having a pattern, having a routine every day. Like for example, for me, I would wake up, I make sure I wake up early and I drink lemon water. That's my thing, and I meditate. And then I start my day. So at least that's a ritual. I will not go past that. So I know I'm getting that in. So once you get one certain ritual or something going on, then a habit, you will continue with other habits too, which will improve. So I think starting with something small, like a little habit that you want to start, a good one, a good habit.
Mhm.
You want to start, and then you can start incorporating more things. So
I love that. I mean, I'm big on the habits. So obviously, like you said, beginning new habits, but I also like to break the bad ones,
great.
ones
Yes,
that
that
we
is
maybe know
so
we shouldn't be doing.
that
Maybe
is that is
it's
important.
eating right before bed or eating after dinner when we know we're not hungry. Like, obviously, you may not do that every time, but at least being aware of what you're doing, I think is really
Right.
important, right?
That is
Another one, I
important.
had a patient who had a very bad habit of going through those Andes mints, those green mints.
Oh,
He
they're
ate like a
good
whole
though.
bag a day, and he was doing it because he was anxious, right? We kind
Exactly.
of helped with that and got rid of that because those mints actually made him have prediabetes. It was
Oh
crazy.
wow. Yeah,
Yeah, he was
they're
eating that many
definitely good,
mints.
but they're
Huh?
moderation.
Yes. So he stopped it and his A1C went way down. But it's
Yeah.
just little things like that. You have to find out what's going on so you can break the bad habits and obviously create good ones. Like you said, maybe going to bed earlier and meditating. Like those things are awesome.
But
So,
I do want to mention one thing. Like I had a patient who smoked all the time. Okay, now the smoking is related to a lot of things, including your
oh,
skin,
yeah.
the loss of collagen. So she was coming in with coming in for her treatments every time. And I told her, I said, stopped her. And I'm like, look, you need to stop that first before you do it. Spend all this money. This is not gonna be it's not helping. The collagen is not building, and it's just gonna make it worse. So we went through the process of stopping everything and going with her, like trying to get her off this smoking habit and wearing sunscreen and smoking. These are
Mhm.
small things which help, and it's helped her dramatically. She stopped smoking and she's looking more radiant and vibrant and living better. So I think small habits, I mean, there's some have bad habits, removing them slowly. We
Yeah.
can't do it fast, but this is important. So yeah,
Unfortunately, I think the smoking is kind of a big habit, but
it
sometimes
is.
patients don't make that connection of smoking. They think only
Yeah.
lungs, right? They forget it bothers your skin, your cardiovascular disease. Like you could, get claudication, so that cramping in your leg. So they forget that it's not just the lungs. So I think
Yeah.
that's a big habit to stop. You should
But
definitely be
it's true. But what's
congratulating
crazy?
her.
What's
Yeah.
crazy is that if you tell them it's your lungs are gonna go bad, they don't care. But when you
Nope.
tell them you're gonna get a line or a wrinkle, they're like, so they're very committed. They're like, oh my God, I need to get rid of this now before I look older. I was like, that's just
Yeah.
work. So
It's funny. You have to find what motivates someone, right? I may tell them, oh, your A1C is high, but they may not care about that. You got to find something else that is going to really,
yeah.
be motivating for them to change, right? Yeah.
And then there's a lot about education. A lot of people don't know about, they don't connect sleep with skincare, or
Mhm.
drinking a lot of water with skincare. They think it's just, health versus just skin. So when you combine these
Mhm.
two, they're more motivated to get things done.
Mhm.
So yeah,
Yeah, it's funny. So you mentioned you're not lifestyle medicine, right? You're only obesity
obesity
medicine, not
medicine.
both. Okay, I mean, they cross over so much.
They
It doesn't
do, they do
matter,
cross
but
over.
the pillars, of, lifestyle and obesity medicine are very similar. And they do, obviously go around nutrition, sleep, exercise, which we have not brought up. I don't know if it which you would say it's related to skin aesthetics? I don't
Yes.
know.
The especially resistance training, resistance exercise.
Yeah,
That's especially with that helps. I ask patients to do that, especially when they're trying to lose weight, to
right,
start building up their protein levels as well as, the resistance training, your muscle buildup, because that will help with your collagen as well. And if they do that, they're less prone to having all that sagging, especially if they do it like not a quick weight loss, but a
right.
consistent weight loss. They're less prone to having like the wrinkling and the got look. So I think that's very important. I talk to them all the time about resistance training, strength.
Yeah, I mean, obviously, I talk about it from the, body composition and muscle
Yeah.
mass aspect, but not really the skin. So that's good to know. Maybe I'll find my patient that's motivated by that more than, having
Yeah.
muscles or
I'm
something.
telling you, you tell them about the skin, they're like, okay, I'll do it.
Yeah, yeah. So if someone listening wants to start feeling more confident and youthful, what is one small step they can take today?
One small step is to start showing up. Like, for example, start drinking more water, but make that step or start moving more. Suppose you're taking the elevator, take the stairs. Just something small that you can do to kind of go towards a better lifestyle, and protecting your skin. Wear sunscreen. I would say if you guys are listening to this, start wearing sunscreen. That's so important. Most people don't take that seriously, but it is a pretty serious thing. So start small, start with one act and self-care. Everybody forgets that you got to care about yourself and everything else will follow. So
Mhm.
yeah.
Love that. Yeah. Is there anything else that you want to share about you or your practice that we haven't covered?
So, again, we already talked about holistic approach. I do primary care, it's more concierge style, and I do wellness and aesthetics all mixed together. So I think having when you come to our practice, you'll have a full body approach and it's very personalized and it is with a physician. I am, I don't just deal with primary care, I'm also a hospital doctor too.
Oh,
So I do deal with the critical things at the hospital. So when somebody comes in, I can help navigate the medical system as well, try to get you to the right places where, you need the help. I can help with that as well. So it's a whole body approach, but also the medical side I would take care of. So
hmm Yeah, I forgot to ask you and mention that you are still practicing in the hospital. So thank you for bringing that up. Awesome. So where can people find you if they want to work with you, or hopefully not find you in the hospital, but find you in your practice?
So I actually have two clinics, one in Lutz, it's really close to the Outlet Mall, and then I have one satellite clinic in New York City, in Queens. So not this for the Tampa people, it's here in Lutz, and I'm very active on Instagram. I talk a lot about different procedures and everything, a lot of education. So you can find me on Instagram at ZenLife MD underscore, or you can call the clinic and make an appointment with me, and we can definitely talk.
Awesome. Well, we will definitely include that in the show notes. And it sounds like you're definitely one to follow. So everybody follow her at ZenLifeMD underscore on Instagram. And thank you so much, Dr. Kareem, for joining me on the podcast today. And everybody, please stay tuned next week for next week's episode. Get healthy, Tampa Bay.
Thank you so much.